Go ahead and, when you're ready, breathe in and close your mouth. We inflate, and then we release. It's punks. And this moves. Yeah. You can push, that bone is moving. The skull and facial bones are supposed to move like that, and you can feel the change. Before, there was no change, it was restricted. Oh, there you go. That was like actually really easy.
My sound sensitivity, emotional regulation, and light sensitivity have all gotten way better. Like really, like almost cured. I don't know.
Right there. Where'd you know?
I love this thing. It's just super relaxing. It helps me relax up above my eyes, and I put it on my jaw. It feels really good. I'm on the top of my head. It just helps me feel really calm.
Hey, what's up, Sharon? Tell us about these concussions you had and these different therapies you tried and how we were able to help you and other practitioners helped you. And then once you did cranial facial release, how it totally made a huge difference with how your brain felt, which affected every symptom of your body, including all these. Tell us about it.
I had sound sensitivity and light sensitivity, emotional regulation. There was a point where I was crying every single day, several times a day. And I had some headaches, mostly around my eyes. I went to physical therapy and that helped. Primitive reflex exercises, eye exercises, and like some other exercises. Started seeing Dr. Salisbury and started getting my upper cervical treatments, including my Allison axis, which were off. And then also started using his laser as well as the Vilight brain laser almost every day. And I saw gradual improvement from these things. I also started taking a bunch of supplements, tried a few other things. I was pretty much trying everything I could find out about, and I had gradual improvement. I had a setback where I kind of got a little bit worse injury, and then it all kicked into high gear again. And we just kept doing all of these things, and we came to the point where we started doing cranial facial release. And it helped so much. Within a couple of weeks, my sound sensitivity, light sensitivity, and emotional regulation was way better, way better. Like I still have just the tiniest tinge of it, but it's just way better. And we're not done yet. We're gonna keep going, and it's gonna just keep getting better.
Check out this attitude. She's never given up. She hasn't just listened to one person's perspective, because the more doctors and practitioners you go to and the more you learn on your own, there's different things that seem to help one person more than another. All these different therapies are very beneficial. Sometimes in my clinic, this is all I have to do, or this is all I have to do, or this is all I have to do, etc. The V-Light delivers infrared light into the brain to heal damaged or dying tissue, helps with blood flow, and it calms the brain down and puts into an alpha or a gamma brainwave, depending on which device you use. There's a lot of good research on that, so it's very cool. It's very inexpensive considering the benefit it can provide. But cranial facial release, what the heck is that? Let's show the people. We're gonna use cranial facial release technique today on Sharon, who has overcome a lot of her symptoms from post-concussion syndrome. Isn't that right?
Yes.
She's so excited about this. We've done a round of treatment. She wants to do a couple more, maybe hoping to get that last little percentage of improvement, but you've done a lot better, right?
Yes, so I had,
Yeah, we can talk.
I had a lot of sound sensitivity, light sensitivity, and emotional regulation issues. And since August, I've been doing PT, seeing him for upper cervical, doing the brain laser, and all that stuff kind of helped gradually. And then I started doing the cranial facial release, and it was like a huge
change, yeah.
Huge change. My sound sensitivity, emotional regulation, and light sensitivity have all gotten way better. Like really, like almost cured. I don't know, I won't say all the way, but I still have some headaches, and we're working on the upper cervical stuff. So I've added a couple of extra cranial facial release.
All this sensory overload stuff's done a lot better, and all this head pain and everything, huh?
Yeah.
She's a downhill biker, so she loves flying down, doing the dangerous stunts you see on YouTube. And after several falls, she just decided she's got to slow down and heal what's been going on. But this cranial facial release has been awesome. What we're doing is we're mobilizing all these different bones. You can see the bones of the face and skull are colored different. You come up close here. The one we're impacting most is the red bone, and this is called the sphenoid. You can see inside there. So the red bone, the sphenoid, is the keystone, meaning all the skull bones and all the facial bones articulate with it. So when we go through the nose, we're actually coming in through here. we're going to be resting in the back of our nasopharynx, and when we inflate it, it's going to mobilize the sphenoid bone here. And that brings a tremendous amount of relief to what previously was restricted her bone movement here. When we would feel there's a lot of restriction, now it moves much more freely, and she gets this euphoric experience that's lasting, as it does with all of our patients. So here we go. She knows exactly what to expect. She's going to be breathing in and out of her mouth. Let it go in here. Keep breathing. Definitely not a comfortable experience, but it's very, very quick. She's tough. She's done this a couple times. When you're ready, breathe in and close your mouth. We inflate, and then we release. There's that expansion and that pressure, and then it releases.
I'm really calm this time, but it was harder the first few times.
Of course. Yeah. She's a professional. She's been through this. She's experienced.
It's worth it though.
Yeah. You ready for the other side?
Sure.
Wow, she's ready to go. When you're ready, breathe in and hold your breath. See, it's this tremendous amount of uncomfortable pressure, and you can feel it actually popping in your ear. You feel cracking noises. All right, now that we've done the internal mobilization with the ballooning, everything is primed, meaning all the sutures and all the connections between the skull and facial bones are more malleable when we do some external work. So we're going to be working on the different areas through her zygomatic arch and the maxilla, and especially here where the ethmoid bone converges with everything behind. What we're going to do is use some manual work here. The palate and the frontal bone and everything in between gets pumped. And this moves so much. He knows how this feels. So you can come up close here. Just breathe in your nose and out your mouth. And before, this felt so restricted. Now when I push, I can feel a lot of movement. And that's what we're designed to have. There's a natural cranial rhythm so that the skull and facial bones move. Like right now, as I'm pulling up the frontal lobe and I'm pushing down on the maxilla through the ethmoid, there's this tremendous amount of movement that I can feel underneath. And she could feel this herself. If she reached up here and pressed, yeah, you can push, that bone is moving. The skull and facial bones are supposed to move like that, and you can feel the change. Before, there was no change, it was restricted. And if you have, in your normal physiology, and you're supposed to have that move and it's not, it's going to affect the physiology, and it's going to cause a backflow of cerebrospinal fluid and proper breathing and other problems. So now that this is all completely open, she can get into a parasympathetic rest and digest state a lot easier because it's freely going through. Every time she breathes, that air is going right through to her brain. And the skull bones are moving the way they're designed to, except this side. This is the one side that's a little bit more restricted. Oh, there we go. That was like actually really easy to release. This used to be the worst part right here when I'd feel in here just resistant, so a lot of resistance. This part can somewhat be painful.
Ow.
That little ow. Oops. What's happening is all these sensitive muscles are static, stuck in a position. When we introduce the vibration to a solid object such as a bone, the entire bone vibrates. If I were to take a tuning fork or anything that vibrates to this object or to the window, the entire thing would shake a little bit. When that happens here to the bone, in the exact direction it needs to be going according to what we found on the x-ray. This has been positioned as such, so it's customized to her. When we introduce that vibrational impulse in the correct vector, what happens is the entire bone shakes. All the little muscle attachments that are configured to be tight are stunned because they don't know which way to be tight when the whole thing's shaking. All the muscles, therefore, are stunned for a moment. And when that vibrational impulse gently taps that bone where it needs to go, when it settles, all the muscles are now in a new configuration and they protect that new area that we put it into. And when she lays on her back, all that spinal tension should be reduced, letting us know that it's in a better place. We've gotten to know her body really well. Let's pull your chin down slightly. So yeah, right there. It just takes one little impulse right here. So right there. Go ahead and lay on your back. Let's see how that spinal tension's doing. And what we're going to do is we're looking for this. This is easy for me to feel and the patient to feel where that tension was before to how it is after. feels neutral. Do you remember how it felt originally? It used to feel really tight, crazy tight. Go ahead and sit up. And she knows she'll keep her neck straight for a little bit, and we'll go rest in his rear grip. Much better, much more loose through here. There's more symmetry. That means her brain is gonna be getting symmetrical signaling when she's neutral. When you're turning your head to the right, these muscles should tighten up. When you turn your head to the left, the opposite side should tighten up. But if you're just sitting neutral and this side's tightening, the brain thinks that she's turning, and so it triggers all sorts of tension throughout her spine. And that has to go away if we want to get her better. It's not going to go away with medications. Those won't fix the problem. Something she's also been coming in for is upper cervical care. The upper vertebrae here, the second bone, as I'm cradling her head, I'm checking the movement of this. There's a lot of clumpiness is the word she uses and I use, from the muscles up here that are really stuck and pulling that bone out. It's blocking normal physiology, trying to get in and out of her brain, like blood flow, cerebral spinal fluid flow, and vital nerve signaling. And that tension up here on the right triggers her back to spasm and tighten, which puts her brain more into a stressful state all the time. So it's been a really integral part, and it's doing a lot better. But there's this tightness to that second and third bone, just like it shows up on the x-ray, so we know exactly precisely how to move that. And that's not painful, is it?
No.
No? This way. Now that we push that bone across, I'm actually gonna pull it around because it needs a little bit more help. Pull your chin down. Good. That's a little bit better in here. We're actually gonna do a little bit of massaging here too to really help that. Go ahead and lay on your side, face this way. See these little muscles? These are mirrored on both sides, but this blue bone right here is representing the atlas. Then the spinous process here of the second bone is what we were feeling. It doesn't move well. We've been able to move it back more to midline. Now we're gonna work through all these muscles to release all that tension that's built up and scar formation. Because in an attempt to protect this vulnerable area, the neck has started to lock down and it's really inhibiting her ability to heal well. And we are working with the body. This will wind back up if we don't stay on top of it, and we have to have a few consistent visits together. Otherwise there's no change, is that right?
Right.
But she's dedicated. She comes all the way down from Park City. And she's the type that's decided she doesn't not want to deal with this. She's willing to do whatever it takes, and she's on her path to heal completely from this head injury. See that bone right here? It's rotated up, which is to her right, and we're able to definitely feel a lot of resistance in there. Not nearly what it used to be. As we work through here, she'll let us know if it's too painful. How's that feel?
Good.
We need to come all the way down to where the trap, the origin and insertion, all the way through here. And we're going to do some work with the suboccipital muscles, and all the way up into the cranium we'll do some holds and some things. But now you get a feel for a lot of these cases. They need more than just moving the atlas. We need to be working with the neck, in totality. So that's definitely appropriate for the day. That should be good. Go ahead and lay on your back. Tell us about the Resimax, what it's done for you since you had concussions.
I love this thing. It's just super relaxing. It helps me relax up above my eyes, and I put it on my jaw. It feels really good. I'm on the top of my head. It just helps me feel really calm.
So yeah, with a concussion, you can have your senses go out of control. So your heightened sensitivity to sound and light, and your emotions can get stressed. There's some other therapies you did that were curative and really helped her. But this by itself is something that really could temper her anxiety and her stress and her overactivity. It's just something she could do anytime she was starting to feel stressed, or when she wasn't, just because it's so calming. And the reason why it works is because in the face is the trigeminal nerve. It is flared up when someone's in a heightened stress state. So if you've had a concussion, or if you've had an emotional experience, those are things that put your brain in a fight or flight pattern. So look at this. The nervous system, the automatic part of the nervous system can be either fight or flight or rest and digest. When you're stressed out, no matter the cause, it makes your heart rate go up. It decreases salivation because that's not needed because you're not digesting or being in a calm state. And the brain gets into a state where every system of the body is accommodating for that, including your eyes and the pupils. So if you can come into the face with vibration, especially the way the Tuner Pro Part 2, this is much better than the first one they had. This really calms the oversensitivity of the nervous system down, so a patient can, on their own, hack their brain, turn their brain from the stress off so their brain can start focusing on activating the vagus nerve and all the parasympathetic functions. It's a very cool tool. So if you're looking at a way to overcome your stress and anxiety, getting into a breathing ritual and using something to hack your neurology to activate it and make it better, this is a great tool for that. Message me if you want to know more. We can get you, I think it's 10% off. I've got a discount code. It's Dr. Salisbury, so Dr. Salisbury, and you can type that in at the checkout and they'll get you one. But it's really great. A lot of our patients love it. Message me if you have any questions. What else do you want to say to anybody?
The cranial facial release is not particularly pleasant, but it's it's pretty fast, and it just really helped me a lot. That's you. Cool. Thank you so much.
We hope this just finds you well. If you're looking for a solution, don't give up. Don't just take medications, please. Don't just take the anxiety.
I almost took Zoloft, but I didn't have to. It's sitting on my dresser.
She even talked to me about it. I think I'm going to need to do this. And we just tried even one other thing, and all of it cumulatively has benefited her. But this particularly has made a big difference in her case. So if you need help, if you're looking for a solution, please message me. I'm here to help you. We can help you find a practitioner where you live. We do have a lot of people that travel here, but usually that's because they can't find someone in their area that can help. But it works. And people feel better. Look at that beautiful smile. Okay, thanks for watching today. Please subscribe so we can get the word out to more people. And message or comment below if you have anything that's helped you with your concussion so people can learn from your experience. Have a happy day. Thanks.